Hi, my name is Dr. Julie Fietta. Today we're going to be hearing from a physician's assistant who specializes in pulmonology at the UPMC Long-COVID Recovery Clinic, Karla Yoney. We invited Karla Yoney here today to provide us with some insight based on her extensive experience working with the long-COVID population. So welcome, Karla.
Hi, Julie. Thank you for having me. My name is Karla Yoney. I'm an advanced practice provider at the UPMC Post-COVID Recovery Clinic, and I've been seeing patients for about 2.5 years with long COVID. So despite all the unknowns, we have gained a lot of experience in our time working with patients.
Well, thank you so much for taking the time to talk with us today. To start out with, I'm just going to ask you to tell us what long COVID is in terms of how you would describe it to a patient who's coming in and exhibiting symptoms.
Sure, good question. So long COVID, in its most simple definition, is it's the signs and symptoms that start with COVID or shortly after and last for 2 to 3 months or longer. In our experience, there's generally 2 broad categories of long COVID patients that we see. The first type in the majority of patients are those in which COVID, with long COVID, they will get better. It's just that first 6 to 12 months after COVID can be a recovery period. And this is, considered a very long time for a lot of patients that have been previously healthy before contracting acute COVID. So there are people that have a prolonged recovery. The other category of long COVID patients are those in which there are new diagnoses made after their initial COVID infection that may explain their symptoms and are under this long COVID umbrella. And the management of those new conditions diagnosed dictate their long COVID presentation and management.
Well, thank you. So my team and I have recently come across the term long haulers. Can you describe the difference between somebody who might be considered or consider themselves a long COVID long hauler versus others who might have a more recent case of long COVID? Could that look different?
Yeah, so I think this brings up a good point that long COVID, the term in and of itself is a blanket term. So what long COVID means to one person may look totally different to another. So that brings us to the point that acute COVID has been around since 2020. And there were many patients that were hospitalized in 2020, 2021 that had pneumonia and were hospitalized with severe respiratory distress syndrome requiring oxygen. And for patients that survived and were discharged, not only are they moving forward with their lives, but what they may be dealing with is the end organ damage from COVID itself. So the long haulers that we look back to from 2020, they may be dealing with lung damage that can be identified on an imaging or testing. But we also have these other long COVID patients from more recent times, 2021, 2022, patients that were not hospitalized in which they have long COVID symptoms, but their symptoms are not showing up on imaging. So again, it's this blanket term with a broad presentation. And so maybe the important thing to keep in mind is when somebody does say they have long COVID, that's just the first of many questions that need to be asked.
That's a great point. It's like a lot of different conditions where everyone's experience is going to be different. So it's not just understanding the disease or the condition, it's also understanding the individual's experience. Okay. So one of the difficulties with long COVID is that it tends to present like an invisible disability. It's not necessarily obvious to family and friends that someone is suffering from long COVID. So what we've heard and what we've read from different people who've had long COVID is that it can be really difficult to advocate for themselves and get others, whether it's family members, friends, employers, care providers. It's hard to get those other individuals to really understand what they're going through and how real their symptoms are. So do you have any advice or guidance that you can give to patients that maybe the patients that you see regarding how they can communicate with their family members and friends or otherwise to help them understand what that individual is going through and what they need?
Sure. Yeah. So long COVID for many patients is obviously complicated and challenging. And then, like you said, add on top of it that a lot of times it does feel invisible. Patients may not have abnormal tests to explain their symptoms, etc. So the best thing that I advise my patients to do when trying to navigate their new, health situation is, I always say focus on the symptoms. Unfortunately, with long COVID, as well as other medical conditions over time, when they were first discovered or newly diagnosed, they weren't always broadly recognized, which is very unfortunate. But because long COVID is a new concept, rather than getting caught up on the terminology of long COVID itself, which a lot of people get blinded to, I always tell patients, focus on your symptoms. So for one long COVID patient, that may mean, I can't sleep at night now, and I wake up and I'm tired and I have to take naps, rather than being like, oh, I have long COVID, I can't do such and such. Say, my sleep's been very disrupted and I may have to nap throughout the day to make sure I can do what I want to do. Maybe another example would be, I used to go drive long distances, but I have dizziness or some kind of new anxiety that prevents it. Rather than saying long COVID and people, again, being blinded maybe to that term if they're not receptive to it, just explain, my ability to go do something socially is limited, but I can find a way to, tailor things. So again, just really focusing on functioning and symptoms, and no patient should be ashamed to use the term long COVID, but again, recognizing that because it's newer, that can really blind people to hearing the details and really looking at somebody as an individual.
No, that's great advice. So they're helping the people that they're talking to understand what long COVID is in their answers. Okay, I just have one more question, and what you just said alludes to it in some ways, but I'll ask you further. What are some of the strategies that someone with long COVID can utilize in managing their symptoms at home? And what sort of strategies could be floating out there that people should actually avoid?
For patients that are maybe three-ish months out from initial COVID infection and are trying to figure out, how do I get back to any daily activity? I hear a very common presentation of where people either don't know how hard to push themselves, say with their activity or exercise, because they don't want to cause harm. And then there's other people that overdo it and are very fatigued after. All of this kind of concept can be summed up into learning how to pace oneself. It's very important that people stay active as tolerated. The last thing I want is somebody to be bedridden, because the longer that you're bedridden, the harder it is going to be to get back to any sense of normalcy. So you may not feel great, but try to do your normal activities. And then as you're ready to maybe try to start going walking, or if you were somebody that liked to go to the gym before, what we've found a lot of success with is partnering with the Rehab Institute specialist of physical therapy, occupational therapy, and speech therapy. A lot of people think of physical therapy as something that you go to once you have an injury, which is correct. But we also utilize it a lot for what we call guided physical reconditioning. So this is going to be an exercise program that's overseen by a professional clinician who is going to help you slowly increase your activity level in a way that's safe to do so and maintainable. So maybe an example of something you would do at home if you can't go to PT is, say you were somebody that walked 2 miles a day. Rather than going back to just walking, 2 miles a day after a week or two after COVID, you would want to start with going for maybe a quarter mile, doing that for a week or so until you're comfortable with it. A week after that, increase it to a half a mile, and then slowly build up from there. So if it takes you, 6 to 8 weeks to get back to walking for 2 miles, then that's totally appropriate. It takes time. Strategies to avoid. If you do have symptoms of post-exertional malaise, which we can see in some long COVID patients, exercise is very tricky and even more of a balance than what I just described. If you do have post-exertional malaise, you absolutely would want to be working with a rehab specialist. Physical therapy, but we actually have a ton of patients that work with occupational therapy. occupational therapy focuses on somebody's functioning, but it's a step down from physical therapy. Other strategies you'd want to avoid is there's a lot of information out there on the internet, and honestly, the best thing is to talk with your doctor. It never hurts to just say, hey, is this something worth trying or not? And so I would really focus on pacing, working with your doctor, asking for a referral to physical therapy or OT, and giving yourself time. And then for everybody across the board, self-care is going to be really important in the recovery ahead.
Well, thank you so much, Karla. That's a lot of great information. We really appreciate your sharing your expertise with us. That's all the questions that I have for today, but I'll go ahead and open it up to you. If there's anything else that you want to add or share, just remembering that we're trying to speak to the individuals that are living with this condition. Any other input?
Yeah, one last thing I like to share with patients is, long COVID with all the unknowns, it can be really scary in and of itself. But what I always like to tell patients is just because we don't know what's causing something doesn't mean we can't try to address something. And with that, what I mean is people will have a wide range of symptoms. So again, one person's long COVID may look very different from another. But again, thinking about symptoms, if you're somebody that, say, has new worsened anxiety, somebody that has a racing heart now, somebody that has shortness of breath, a lot of people I've come across may not be comfortable with different treatments because ultimately we still don't understand long COVID well and we don't have any defined treatments. But I'd like to encourage people to keep an open mind to symptomatic treatment. So an inhaler may help with your breathing, a medication may help with your heart rate, and some people see this as covering up the symptoms, but I wouldn't see it as that. This allows you to manage your symptoms and get back to a better quality of life. So again, takeaway is just because we don't know what's causing long COVID necessarily doesn't mean we can't try to effectively treat it. So I'd encourage people to keep an open mind as well as work with a trusted clinician on things that may help with their symptoms, and that there are things that you can do to feel better.
Well, thank you so much. That's great advice. Of course, I'll remind you that we're speaking in generalities. This is not intended to be medical advice or recommendation for any one patient. Please do speak to your healthcare provider. I am not that kind of doctor.